Welcome to the HeartKids podcast. My name is Tahnee Jash. I'm a proud Yuin Kamilaroi woman and a journalist. I was also born with a heart condition. I'll be presenting a series of episodes looking at Aboriginal and Torres Strait Islander people's experiences of childhood heart disease. Welcome to today's episode. We're joined by Erin Ferguson, a dedicated paediatric RHD clinical nurse consultant at the Happy Heart Clinic in Far North Queensland. Erin and her team are doing fantastic work to improve healthcare services and experiences for patients with rheumatic heart disease. Today, we'll chat about the innovative approaches Erin and the Happy Heart Clinic team are implementing to provide supportive, consistent and equitable care to RHD and CoHD patients across Australia.
Better for our families as well. So a lot of our parents talk about how hard it is to bring their child in for something that they know is painful, to watch their child go through that. So if they can see that we're doing everything we can to help make their child more comfortable and pain-free, of course, it's a lot more of a positive experience for them.
Before we begin, we would like to acknowledge the traditional owners of the lands on which we record. We acknowledge the continuing connections to land, sea, waters and skies and pay our respects to elders past and present. HeartKids treads lightly on country and works in collaboration and support of Aboriginal and Torres Strait Islander people, families and communities impacted by childhood-onset heart disease and rheumatic heart disease. Aboriginal and Torres Strait Islander people are warned this podcast may contain the voices and names of people who have passed. Welcome, Erin. Great to have you on the podcast today.
Thank you. It's good to be here.
Lovely to have you. And so to kick things off, we usually ask our guests to share where they're joining us from today.
Yeah, as you said, I work in Far North Queensland. So I'm actually based in Cairns, the top of Queensland. But the area I cover within my work is Cairns and also the Cape and the Torres Strait. So geographically a pretty big area. And as I said, right at the top of Queensland.
Yeah, that is a really big, vast stretch of the state that you're covering and also the islands in the Torres Strait.
Yeah, absolutely. I don't think people can really grasp how big the area is geographically and the catchment that we have. It's pretty amazing to be able to go to those places and meet the families out there. So, yeah, I feel really privileged to be in this role and to be able to look after those communities.
Definitely. And we'll hear about some of that awesome work that you're doing shortly. But maybe we can start by you sharing with us your path into paediatric healthcare and what kind of led you to your current position at the Happy Heart Clinic.
Yeah, so I actually grew up in Brisbane, still within Queensland, but a long way from North Queensland. And so I started out at the RHD at the time, which is now merged and is the Queensland Children's Hospital. And I'd never actually heard of or encountered rheumatic heart disease there or in my studies. And I actually ended up working and living in Thursday Island in the Torres Strait for nearly 5 years. And that's where I first had these children coming through into the general ward there in Thursday Island being diagnosed with rheumatic heart disease and having to give these injections, which is the treatment that we give, the bicillin injections for rheumatic heart disease and acute rheumatic fever, and just seeing how hard it was for these patients, what a challenge it is, and knowing that having grown up in Brisbane, I'd never encountered this. So I knew that this and came to learn that this was a disease predominantly affecting our First Nations people. And it was really prevalent on Thursday Island back in that time, and still, unfortunately, now it hasn't changed. If anything, it's gotten worse. So that was where I first got the fire in my belly about the injustice of this disease, that it's not affecting everyone. It's been eradicated in the majority of the Australian population over 6 decades ago, but it still has really devastating effects for our First Nations people.
Wow. And I guess for people who are first-time listeners of the podcast, or maybe they're not really familiar with RHD or rheumatic heart disease and acute rheumatic heart fever, can you explain to us a little bit about what it is and how it impacts the body?
Yeah, it's caused by a really common germ, group A strep, which we all get exposed to. It starts from an infected throat or an infected skin sore, again, really common things. And from that, the germs get into the body, travel through the bloodstream, and it causes an immune response in some people that fires off, and the body actually starts attacking itself. So it attacks the joints, it can attack the brain, the skin, and the heart. So once the heart is damaged, that is when it becomes rheumatic heart disease. Acute rheumatic fever is the actual process of that infection that causes that immune response. And we know that once people have had it once, they're very prone to get it again. The only way to manage that is to get them on treatment, which is the monthly bicillin injections. So I mentioned before, this disease has been eradicated in the greater population and across most countries worldwide, most affluent countries like Australia. You just don't see or hear of it anymore, apart from in the Indigenous population. So it is strongly linked to social disadvantage, so living in overcrowded housing situations, lack of access to adequate healthcare. It's really unjust. In saying that, though, we do have lots of children in Cairns itself, so not such an isolated area where we do have access. And we find it's not actually a genetic disease, but we do find it runs in family clusters. So a lot of our children will know other people within their community who have this disease. So it's really easy to prevent in terms of getting these children their antibiotic. We know that it works, but it is a very painful injection that they need to get. The other things that we talk about that can prevent, which we can't influence in health, but is things like the government addressing housing and making sure that all of these people in communities have access to adequate medical care that they need.
That's really important, especially when it can impact vital organs in your body like your heart. And when we're thinking about areas like rural and remote areas that form part of Far North Queensland, but also other states like the Northern Territory and parts of Western Australia as well, to name a few, housing and access to healthcare is really important. And Australia is such a big country, isn't it? We're so spread out and vast parts of land. It's really heartbreaking when you see how some of those things that we do take for granted for those of us who live in big cities, of the access to healthcare and the housing that we have, and for those people who live in rural and remote areas, and how that can impact your health and well-being on a daily basis.
Absolutely. I take any opportunity to talk to people about this. A lot of people, as I said, including myself, until I moved up here, I'd never heard of this disease. So I think people are really shocked to hear that it still exists and the devastating impact that it does have. I talk about in children because that's who I look after, but obviously it impacts older adults as well. Decreases their life expectancy, leads to early stroke. The impact is just devastating, and it shouldn't be happening, not in a wealthy country like Australia. Everyone should have equal access to good care, and we talk about closing the gap all the time. Rheumatic heart disease is one of the biggest contributors to that gap. We really need to shake things up and to get people to recognise that this is a massive problem that we all need to contribute to changing.
Really great points there, Erin. Thank you. And I just wanted to hear a little bit more about the work that you're doing. You've started this Happy Heart Clinic, and I was really keen. It sounds like such a great initiative. And I think for those listeners who aren't familiar about the Happy Heart Clinic and how it started, it'd be really great to hear about, I guess, what inspired you to get this off the ground.
Yeah, so I've mentioned a little bit the treatment for acute rheumatic fever and rheumatic heart disease is monthly bicillin injections. So these injections are given deep into the muscle. They're quite a thick medicine, so it's actually considered one of the most painful injections that you can get. And when we're talking about children with this disease, it's most commonly children aged diagnosed between ages 5 to 14. So obviously no one likes getting needles. These needles are really painful, and it's not just a one-off. They have to get it every 28 days for at least 10 years or until they're 21 from the age of diagnosis. So it's a long time. This is 13 needles a year for at least 10 years. So we're talking about over 100 needles. Unfortunately, and I know a lot of people find this upsetting when I say, but it is happening, that children are getting forcibly restrained to get these needles because people want to get it done and need to get the medication into them, think they're doing the right thing, but forget the impact that that's actually having on the patient. So these children develop needle phobias and get really scared of something that's already awful. Obviously, that throws them off track with their treatment. They don't want to come back to the clinic, to any clinic anymore, to get their injections. And that, of course, puts them at very, very high risk of getting another episode of rheumatic fever, which can cause further heart damage. The implications of them not getting treatment are drastic. So we started noticing in our clinic, which we service with our rates in Far North Queensland, as I mentioned, covering Cairns, Cape and Torres, we have the highest rates of children with rheumatic fever and rheumatic heart disease in the rest of Queensland combined. So we're seeing lots of children here. And we started talking to them about their injections and how they're going. And a lot of children aren't going well. And a big part of that is, as I said, the trauma, the needle phobias and the pain. So we looked at how we can address that. The Happy Heart Clinic started from recognizing some children that were having a lot of trouble getting their needles because they were so scared. And that makes us worried as clinicians because we know when they're not getting their treatment that they're at risk of getting really sick. So we bring them into the clinic and it's nurse-led. So they come in and see me and we have a talk about how we can make things better, how we can get them back on track with their treatment. And what I've found is a lot of that is around giving them choices, giving them back control over this thing that needs to happen to keep them well, but it's not a nice thing to happen. Reminding them that they do need to get this needle, and I talk about why it's so important, but how they get it is up to them. So essentially, the Happy Heart Clinic, it used to be called the High Risk Bicillin Clinic, which isn't a very nice name. So the Happy Heart Clinic is much nicer. And it's for our children who had stopped getting their injections because they were so scared. And they come in and we get them back on track with their injections. And it's been a really successful model. And it's all about collaborating with the patients and their families to make sure that we give them the health journey that makes them feel comfortable.
Yeah, wow, that's awesome. And I think the name change, by the way, I love that, Happy Clinic. It sounds very friendly and inviting, especially when you're coming in to get these really big, scary and painful needles, but really important medicines to look after yourself. And I think that's a really interesting point, like hearing about giving the patient the choice in how they would like to receive their needle. I don't think I've really come across that before. When you go to the doctors and you need to get an injection, you just usually receive it. You don't really have that choice. Hey, it's usually you get what you're given type of thing. And so
absolutely.
Yeah, that's really different.
That's a really strong point that I'd like to make to listeners today. Our congenital heart kids, as well as our children with rheumatic fever and rheumatic heart disease, we're here as clinicians to support you on your health journey. Most of our heart kids, they're in it for the long haul. Their journeys are long, often lifelong, getting lots of blood tests and lots of injections. You guys are allowed to let us know what you want and what works for you. And if we're doing something that makes you feel uncomfortable, then the child themselves or their parent or family can say, actually, this is how they like to do it. And that's fine. A lot of kids have said to me that they feel really scared if they're meeting someone new that they haven't met before that doesn't know how they like to get their injection, that they feel scared to tell them. I know we mentioned before we started talking before about the butt cards, which have been developed in the Happy Heart Clinic.
Yeah,
These are little cards with pictures of bottoms on them because that's where the injection gets put into. And it's all just a nice little tick and flick card so that the children can go through each time and say, this is how I want to get my needle. They can take that card with them if they're meeting someone new. And it's also a really good guide for us as people giving the needle to think, oh, okay, these are the questions I should be asking my patient each time. So some of these kids I've met hundreds of times before, but every time they come in, I still say, how are we going to do it today? So giving them some power, as I said, over this thing that really must make them feel disempowered. So giving them choices about where they want to get the needle, how they want to get the needle, what distraction therapy they'd like to use. It really has been a powerful game changer for these patients to get them back on track with their treatment.
Yeah, wow, that sounds amazing. I just heard you say distraction therapy. Can you tell us a little bit more about that? Is that one of the approaches that the Happy Clinic, I guess, uses that might be different to other places where people are getting their injections?
Absolutely. So again, everything that has been developed in the Happy Heart Clinic has been directly in collaboration with the patient. When I say we, I'm talking about myself and Dr. Ben Reeves, who I think you've also spoken to on your show before, who's the paediatric cardiologist who I work with. Mm-hmm. So we talk to all of our children and families about how they're going with their treatment, and if they're not doing well, what's preventing them from doing well? And if they are doing well, then what's helping them? What are their tips? The most common things that came out of that are managing the pain, which is separate to the distraction. So I guess the two most important things are giving options for pain management and giving options for distraction. We know how powerful the brain is, and when you get scared about something and you're overthinking something and you're stressing about how painful it's going to be, it makes you tense and it makes everything more painful. I try to take their mind off the injection that's happening and get them to focus on something more pleasant. Most often it's as simple as watching something on my phone or playing a game on my phone. We also have a really terrible joke book that we tell jokes out of. It's actually quite crazy. Sometimes you walk past the room and hear lots of laughter coming from it, and I'll walk out and people will say, "Were you giving a needle in there?"
That's a strange reaction from the doctor's room where kids are getting injections.
But remembering these are kids, so we need to make it fun. Being on a health journey is hard anyway, much less when you're a little kid. So I do whatever I can to bring it back to trying to make it an enjoyable experience. So we get bubbles out, we get jokes out. We've got actual medical devices, which a lot of listeners may have seen before, called a Buzzy Bee, which is a little vibrating device that's placed above the site of pain. And that's actually distracting the neurotransmitters from the side of the pain to the brain. So that's a medical tool essentially, but it does help, along with other basic things like using an ice pack to numb the site before. The big thing that we use in our clinic, which is quite new and revolutionary, I guess, is the use of Entonox gas. So you might have heard of it, happy gas, laughing gas. So that just requires the children to do deep breaths of the gas while they're getting the needle. As soon as they stop breathing, it wears off. So it doesn't mean that they're sedated and need to stay in hospital for a long time after getting their needle. It's very safe to use. And as well as helping relax them, it also helps with the pain. So that has, for these highly traumatized children, has really helped turn them around. So we're managing their pain effectively, we're giving them choices, and we're making it as fun an experience as getting a needle can be.
Wow, that's such great work. And I think all of those initiatives are wonderful and very much aligned with the name Happy Clinic. It feels like a place where you can feel comfortable and at ease and safe while you're getting those really important medicines.
Absolutely. Better for our families as well. So a lot of our parents talk about how hard it is to bring their child in for something that they know is painful, to watch their child go through that. So if they can see that we're doing everything we can to help make their child more comfortable and pain-free, of course, it's a lot more of a positive experience for them. I've got children myself, and I can't imagine having to bring them in every 28 days to get something that you know is causing them pain. So that's a big consideration as well. And also from my perspective as a nurse, I don't come to work, and I'm sure nobody comes to work wanting to cause harm or know that you're hurting somebody. So to be able to think through how you can make it more fun and a better experience, it also gives me a better experience as well. So I'm not worried or I'm causing harm or hurt to this child, even though I know I have to do it because it's the treatment they need. It's still really hard to think that you're causing a child discomfort. So it makes me feel a lot better as well.
Yeah, it must. And has there been any sort of stories or sort of cases where you've seen a difference in patients from who've come to the Happy Clinic? Sorry, I'm putting you on the spot here, but like any sort of clients that have really benefited from this, I guess, this approach?
Well, the clinic's been up and running for around 4 years now. We get lots of children come and go, and some of them just need a couple of visits and then they're fine to go back from community. But I mentioned before, these are the children who'd actually stopped getting treatment. So we were really worried about their hearts. These are children who already have heart damage. And we know that if we didn't get them back on track, the ramifications could be really serious for them. If their heart gets too damaged, they end up needing open heart surgery. It's pretty big stakes. We've taken to date 25 children from getting none of their treatment to being fully back on track with their treatment and willingly coming into the clinic to get that. So the original Happy Heart Clinic patient is now 13. He was 7 when he started, and he was one of those children who was so terrified. And he and his mum are both amazing advocates for rheumatic heart disease now, and he's had 100% of his treatment for the past 5 years, which is just incredible. Got a little 6-year-old boy. He was diagnosed when he was 4, which, as you can imagine, is a massive deal to give a 4-year-old these big, painful needles. So he's now back on track now. We share the same birthday, so we're birthday buddies. So last year he bought me in a birthday card and some flowers and said, thank you. He wrote on the card, thank you, Erin, for everything you do for me. And I'm like, I give you a needle every month.
Oh, that is so sweet. And that's so beautiful. Hey.
Yeah. I've got a great photo of him. We've had him, his 5 siblings in the room. We had Peppa Pig on the TV and bubbles going around. So it was like a Bicillin bubble party. So when people say to me, how do you make it fun? I show them that photo. I'm like, it is possible to make it a fun experience. I promise you.
Yeah, that is your evidence.
Absolutely.
Oh, that is so sweet. That is so sweet. Thank you for sharing all of that. That was really, really, really great. And great to hear about how, I guess, the patients are really the focus of the work that you do and how you deliver your care for them. I understand the impact of the clinic is being amplified through new initiatives and advocacy, particularly in increasing care. Can you tell us about the broader work you've been doing? You spoke a little bit about the anesthetic, the drug Entonox. Is there any sort of other advocacy work that you guys have been doing to help?
I said before that this disease is widely spread across some of the most remote communities in Australia. So not just in Queensland, but in the Northern Territory, WA, and other remote regions. When I was thinking about how we can make things better, I don't just want it to be better for my kids that I can see in Cairns. I want it to be better for all the kids out there. So I tried to make it as adaptable as I can, that I don't use any particularly fancy tools that you can't use somewhere else. And as I said, a lot of it is just about having a conversation and giving choices and making it a bit fun. The Entonox is the thing that is quite limited. So currently only available within Queensland health settings. Other states and territories are looking at rolling it out. It's been introduced to a couple of our Aboriginal medical centres in the region, which means children don't have to travel all the way into Cairns Hospital to access it, which is great.
Wow, that's great.
Even within our region itself, it can be, we've got one girl that travels for over an hour and 20 minutes to come for her injection, because previously this Cairns Hospital was the only place where she could get it done. So now we've got somewhere down the road from her where she can go and get that. Also looking at setting up one of our local GP practices really is a model that I'm really keen, which is part of the reason why I was really keen to jump on and talk to you today, to talk to people about just rethinking how you're giving not just these Bicillin injections for RHD patients, but also all of our HeartKids, about the impact that treatment has probably had on them from a really young age, and how we can set them up to keep wanting to access healthcare throughout their life, to feel safe and to feel empowered. And certainly I come from a place of wanting children, no matter where they live, despite their geographical location, I feel like they should have equitable access to great quality medical care. And these injection experiences are something that can really easily be changed to make more beneficial for the patients by clinicians if they're just mindful of those things. So I talk to a lot of people about the gas. People are worried about the long-term effects it can have and that it's a big deal. And as I said before, it's not like you're heavily sedating a patient. Once they stop breathing the gas in, it wears off and they can go home usually within a few minutes afterwards. It just has been an absolute game changer. It's not for everyone. It's certainly something that I offer for children with their first injection to make that first one positive. I don't know if I made this point before, but one bad injection for these kids, when I say bad injection, I mean one negative experience can be enough to throw them off track with their treatment. They just get scared and don't want to come back. And that's really on us as clinicians to make sure that we're thinking through. For us, it might be one-off that we're giving this child their needle. Remember, this child needs to get hundreds of these needles, so we need to make sure everyone's right. And often that's just taking a bit of extra time with them as well.
Yeah, that's really important, I guess, to think about as a clinician, creating those positive experiences, especially when children are young. So it encourages them to keep coming back and not feeling traumatized and really scared about that experience when they know it's coming up to that date to go and see the doctor again. Would there be any other advice you would give to clinicians around how to deliver that care in a really patient-centered approach?
Every child is different. There's not one, I call it every child has a different recipe. There's not one fit for everyone, which is why we've got those cards as well. So you can actually go through and ask those questions to prompt them about how they would like to do it. And they might even want to switch it up each time they get the injection. They might want to try something a bit different. So I think it's about, I said before that we talk to children about how they're going and when they're not doing well. And the number one thing that children say when they are doing well is that people are nice to them. They're not even talking about the pain of the injection or the experience around the actual physical getting their injection. It's the feeling that the person that is in that clinic is treating them like a person and remembering how important it is to build that rapport. I think when they're saying being kind, it's just bringing that human touch back to it. As I said, it's not just a task that, yep, I got the needle done, tick. It's about this child, this is a massive health journey for them. How can I make them feel part of it and let them know that I actually care about them?
That's really important.
That's something that I love to tell everyone, that you don't have to be the best needle giver in the world. You just need to remember to be kind, because that's what the kids take away from that experience, which is pretty special when you think about it. We all have control over that, and I think that's really cool.
And the fact that they're telling you that and it's making a difference is really important too. Hey, little things that you can do that can change the whole experience of that trip to the doctor.
Yeah, and not just that experience, but to keep them on track with their essential treatment. It's a really powerful position for us to be in. I don't like to make people feel bad when I talk about this stuff. I just wanted to let them know that there's a whole bag of tricks that we have up our sleeves as clinicians that can really help, particularly when we're dealing with children.
That's so true. And what are some practical steps that clinicians can take to make the process of receiving these injections regularly less daunting, I guess, for the families and the patients? Maybe things they can do in the preparation or the lead up. Do you have some sort of advice there?
Yeah. The children, the major issues that they talk about when they're struggling to get their needles are, as we've spoken about a lot, the pain. Offering different methods for that. So as I mentioned before, the ice pack, the Buzzy Bee are really basic things that you can offer. And it's not just the pain of getting the needle, it's after as well. They get muscle pain. So offering them and reminding them they can have some paracetamol, that's perfectly safe to do. Children say, as I said before, that they feel forced to do it. They get treated like a dartboard. So really negative stuff that these children are taking away from the experience. They say they get really scared when they're sitting in the waiting room for a long time because they have more time to think about what's coming. So I try my best to get them straight in and get it done so they're not waiting around for ages, which I know in a busy clinic can be hard, but prioritizing getting that done for the child so they're not getting more anxious thinking about it. Having a family member who can be that support for the child, as I said before, it can be really traumatic as well for family. So maybe someone else, maybe auntie or cousin or someone else is that better person than the actual parent, which is fine. So I have that talk with people as well. from the really basic perspective of actually giving the needle, it needs to be nice and warm, the medicine, before you give it. So I just hold it in my hand while I'm talking to the child. So it's at room temperature because it's stored in the fridge. The children tell us if it's cold, it hurts more. Also, if people give it too fast, it hurts more. So the directions say to give it over 2 to 3 minutes, which is a really long time when you're pushing a needle into someone. That's where all the stuff like the joke books and the phone comes in. It's not just, I should have mentioned that before, it's not just a quick needle like your flu shot. It actually takes a couple of minutes. So it's the preparation around before the needle and then while you're actually giving it. And then obviously afterwards making sure that they know if they want to go home and rest, that's a good idea. Again, a different recipe for everyone afterwards. Some children say they go run it off and they're fine. Other children say they need to actually go home and sit down. It's really sore. So whatever works for them.
So that's some great advice for clinicians. What would be your advice for parents of children that are having their needles? Is there sort of some advice that you'd give to families and parents?
I always give parents their child's most important person, obviously. So most children will want their parents close by and feel comforted by them holding their hand. I mentioned my little boy before who started when he was only 4. So I spoke about children being forcibly restrained, which is very different from having a cuddle with the parent to keep them calm and still while I'm giving the needle. That is still a technique that I use. So mum's giving the child the cuddle and keeping them still so everyone's safe, but it's not like 4 adults jumping on top of a child and holding them down. In saying that, I have had some parents saying, Erin, I feel really distressed being in the room and watching it, and you can tell that that's actually stressing their child more. If a parent says that to me, that's perfectly fine. I certainly won't make them feel guilty or shame for not wanting to be in the room. So that's a conversation that I'll have as well. So it really is involving the whole family or the people who come in each visit about how they want to do it today. And of course, talking to the family afterwards about how they think it went and anything they want to do differently, letting the parents know if they have any problems, they can talk to me about it, that they don't need to feel worried. I had a mum come in the other day and said, you gave the last needle and he had a lot of pain afterwards. And she said, he's a bit embarrassed to tell you. And I said, that's fine. It turned out he'd gone and played sport at school afterwards, and normally he would go straight home and rest. I think people get scared to talk to us, the people looking after them, that they're going to upset us. And that certainly we're here to help and to make sure that your experience is positive. From my perspective, I certainly would rather people be open about anything that they'd like to change, or if they've got any questions or concerns. People are in control of their healthcare and it's their right to be able to ask questions about it.
And I think that's a really good point, actually, about feedback. Sometimes for parents, exactly how you just put it then, it can be scary, or they're worried about offending the clinician who's giving the needle to their children. Is there any advice that you'd offer to parents around that, so then they can help their children, I guess, go through this process to make it a little less scary or uncomfortable, and how to kind of voice their concerns or any feedback that they might have to make that process a little bit more easier for everyone?
Yeah. So I guess it's the way that you approach it. Obviously, if you're getting really upset and angry with someone, then they will get defensive and probably won't be an easy conversation. But like how I explained with this mum, she said, oh, Erin, the last kind of explained in a nice way and saying that her son didn't want to make a big deal of it, but this is what happened. So it's not confronting for me like they're having a go at me. They're just explaining what happened and how we can improve things. We do get some people who get really angry with us, and that's upsetting. We're all here to try and help. So I think if you just approach it calmly and from a place of wanting to improve things for your child or family member, that hopefully everyone would be really receptive to that. But also, that's what I'm trying to do, is take that pressure off the child or the family by getting clinicians to actually ask the question that they're putting it out there. So asking before the injection, how do you want to do it? And then asking them afterwards, how did that go today? And do you want to do anything differently next time?
And it's creating that sort of space where it's people can be open and honest and feel comfortable and safe, I guess. Yeah, really, really great points. I think that was sort of all the questions that I had there for you. We've spoken a lot about some advice around things that parents can do to help make the experience better for their children, things that clinicians can do to make the experience better for their clients, also the great work that you're doing at the Happy Clinic and the different patient-centered approach that you guys are taking that a lot of clinics and clinicians can learn from and implement in their own way, that they're providing that care to their patients. Is there any sort of other points that you think are really important to share that we haven't touched on today?
I don't think so. Certainly, I use these opportunities as a chance to give my patients a voice, which I think if you go about your practice like that, then you can't go wrong. And that's why I'm really proud of the resources that have come out of the Happy Heart Clinic, because it's not really my work, it's the kids' work. It's their ideas that I've made come to life. And I think that's really powerful because there's lots of stuff that we think would be a good idea, but when you're actually asking each individual child, what do you think of this? And they're like, nah, and they've really guided it the whole way. I think that's what's made it really special. And actually really easy to make happen. We're a little clinic in Cairns. Up until recently, there was only 2 of us, myself and Dr. Ben Reeves. So it's not like we have heaps of resources or anything. We've just made this all come to life by talking to our patients, essentially, which has been a real game changer for us, and to open up how we provide our service to make sure it's the service that works for our families.
Yeah, it's incredible the work that you're doing and the power of just getting that feedback and listening to your patients and the impact that it's having on their lives. And as you mentioned at the start of the conversation, when we're looking at the big things like closing the gap and how this impacts on First Nations people and their life expectancy and a disease that non-Indigenous people aren't suffering at the same rate, the patient feedback and implementing that is really important. And just as you say, a game changer.
Absolutely. Easily transferable for anyone in health, really. It's not just with heart disease, it's with any disease, just taking that time to talk to your patients about, hey, how can we do this so it works for you as well?
Yeah, great points. Well, thank you so much, Erin, for coming onto the podcast today. Thank you for sharing all of your great knowledge and your insights and your time with us. So appreciative, and really value everything that you've shared with us and our listeners today.
Thank you so much for having me.
Our pleasure. If this episode has brought up anything for you, or you need some advice or guidance on yours or your family's CHD journey, you can call the HeartKids helpline on 1-800-432-785. To access more information and find out more about the support HeartKids offers, visit the website at heartkids.org.au. The information in this podcast is not a substitute for medical advice from your doctor or healthcare team. Always talk to your doctor about matters that affect yours or your family's health.